Hi, my name is Iceland Coker.
My name is Kenyatta Gilchrist.
And my name is Jamia Hope.
And today we will discuss late-stage dementia and dysphagia.
First, we're going to talk about what you can expect in late-stage dementia. So obviously when these people are getting older and they develop dementia, they're going to have cognitive issues. And so this can affect them remembering how to eat, remembering social appropriateness, remembering to eat at all. We also can expect physiological changes as they get older. And this can cause things such as oral preparation difficulties, drooling, regurgitation. These are things that can develop as the dementia progresses. And so basically what we found is that typically SLPs, as Dr. Heap has told us in the past, once a patient coughs or does anything out of the ordinary with the swallow, they automatically choose to modify a diet. And so what we found is that with late-stage dementia, artificial nutrition is popular, and this can be provided via NG tube or PEG tube. And what we discovered is instead of just automatically giving these patients a modified diet or a PEG or NG tube, that it's best to consult with a multidisciplinary team about what is best for them, but also consulting with the patients first and their families. And so getting together an advanced care plan that involves them and asking their suggestions before the late stage dementia progresses. And so with involving the patient, they can choose to, as the dementia progresses, to take an NG tube or a PEG tube for nutrition, because obviously you don't want them to be malnourished. But they also can choose to stick with their normal diet. And so what that is called is risk managed eating. And so with the advanced care plan, they can state that, no, I'd rather stick to my own diet. And so with that, we obviously can't just automatically say, okay, so they chose to do this, we're going to be done with them and dismiss them from therapy. But instead, we would give them safety precautions for choosing a risk-managed eating diet. But if they do choose the PEG tube or the NG tube, making sure that we consult with the family, consult with the patient if they're cognitively aware of what's going on, and telling them why this is necessary, and having valuable information to explain why, not just because a patient coughed or just because something minor happened, but giving valuable reasons as to why we are choosing this method of feeding.
So next we're going to talk about some treatment strategies and other things we can do for patients who have dysphagia and are in the late stage of dementia. One of the things we researched was survival times of these patients, because there's not much evidence out there that shows what we can do to increase their survival times when they are being fed through tubes. So what this group of researchers did was they took some patients who were being fed on a PEG tube or an NG tube, and those who were not, and compared their survival times. And so what they found out was not only was the PEG tube safer, it also increased their survival times for living. What they were thinking was it could be that there are improved ways of placing the the PEG tube, and also the different strategies that they were using in combination with the PEG tube as well. So again, what worked out was the PEG tube worked better than the NG tube, and it increased their survival times.
Okay, so in addition to the treatment strategy Iceland just discussed, I'm going to add on another treatment training or strategy as well for persons with dementia. So what we focused on was using spaced retrieval with external aids to improve the use of compensatory strategies during eating, and what that looked like. So first I'll discuss what spaced retrieval is, and that's a learning technique that is a bombardment of basically giving them that information, presenting them with that information over a course of time. So showing them it, taking it away, and seeing if they have, I guess, generalized it over, or if they are grasping the concept of what is being provided to them or presented to them. So, and with the concept of spaced retrieval, it's supposed to start at a small amount of time and increase over the course of the sessions or whatever have you. So what that looked like was the SOP would present the patient with a cue card that would literally write out what the compensatory strategy was, word for word, and they would ask them to read that. So they would show them that during their meal times, and literally instead of telling them, what are you supposed to do after you take a sip of water, it would literally be there for them to kind of have it as like second nature so that they can just see it and know what to do. And we realized that that was a really good strategy and it was very effective. The only thing that I will say about it was that it was used with, I think, moderate patients with dementia. So I would like to see I don't know how effective it would be for patients who were more on the severe side or in the severe aspect, but as far as improvements, there were a lot of improvements as far as them being able to self-regulate their compensatory strategies and things of that nature. So overall, it was a great training, and it was very effective.